Quiz 2, question 5 is also true-false. An individual with receptive aphasia will follow complex verbal commands. This is false. Someone with receptive aphasia cannot receive any kind of spoken language. They don't understand what you're saying. They also don't understand what they're saying. So their words come out nicely formed, yet they don't make any sense. And they don't know that they're not making any sense. Expressive aphasia can understand what you're asking them to do. They have no problems receiving language. They just cannot express themselves. So they can't get their thoughts out, so they're usually very frustrated. Dysarthria is slurred speech, kind of a drunken sailor type of speech. This is very common, and dysarthria can result from right-sided brain damage or left-sided brain damage. Anytime you have weakness of the speech muscles, mouth, tongue, larynx, or incoordination from cerebellar damage, that will result in dysarthria. Balance is recovered via reactive postural control when you push someone unexpectedly. This is true. So reactive postural control occurs in response to unexpected perturbations, and you use feedback mechanisms, as opposed to anticipatory postural control, which is where you know that something's going to destabilize you and you prepare in advance with feed-forward mechanisms. For example, you see something, you see the perturbation coming towards you and you tense up in advance of that perturbation. The last one is probably the one that tripped up the most people. Unilateral neglect is characterized by a left-sided visual field cut. This is not true. Neglect is a perceptual problem where vision is intact. So that person may have 20/20 vision, can see everything. Their brain just chooses to ignore the images that are coming in from one side, usually the left side. Whereas a field cut is a hemianopsia. A field cut is a visual problem. So you cannot see the left side of your world or the right side of the world. So a hemianopsia can occur on the left and the right side, whereas a neglect, a perceptual problem where vision is intact, usually occurs on the left side. So you have a left-sided neglect. Do not confuse these two. It's very easy to do. For some unfortunate patients, you can actually have both a left-sided hemianopsia and a left-sided neglect, but they are separate impairments, and this will be revisited again later.